Hi, my name is Dr. Nisha Vijayan. I'm specialized in ENT surgeries. Now, being an ENT specialist, nasal obstruction or nasal block is among one of the most common complaints that patients present with to the ENT clinic. Patients often complain of a congested nose or a stuffy nose or difficulty in breathing through the nose or open mouth breathing, etc. It is a problem which affects the person's quality of life, and as such is the reason why they seek out or go to see an ENT specialist. This issue can affect all age groups ranging from toddlers to adults. It can also affect a person's speech, making them sound congested, also known as hyponasal speech. In severe or chronic cases, it can also cause persistent mouth breathing and may even result in dental malocclusion if left untreated for a long time. There are a number of causes for a person's inability to breathe through their nose. Among a few of the most common causes are allergies, deviated septum, turbinate hypertrophy, adenoid hypertrophy, nasal polyps, overuse or abuse of decongestant nasal sprays, pregnancy, rhinitis, etc., and the list goes on. The initial important part of investigating a person's nasal obstruction is nasal endoscopy. Nasal endoscopy enables to examine or visualize the posterior or the back half of the nose, which is not seen by just looking into the nose with a headlight. Now, the treatment options for nasal obstruction can vary depending on what the underlying cause is. Now, in terms of treatment pertaining to allergies, oral and topical antihistamines, nasal steroid sprays, they form the first line of management. Coming for those with deviated septum, there is a procedure called septoplasty, which basically straightens out the nasal septum and allows adequate airflow through both the nasal cavities. For patients with turbinate hypertrophy, turbinate reduction procedures are advised. These are mainly advised to patients who don't respond to medical therapy. In terms of nasal polyp, really the only way of dealing with this particular problem is sinus surgery, which involves removal of the polyps from the sinuses involved. Now, for those suffering from adenoid hypertrophy, simply removing the adenoids or doing an adenoidectomy will help with the issue. So these were some of the common causes of nasal obstruction and the treatment modalities used for nasal obstruction. Thank you.